what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. Like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah.
Welcome, and good evening wherever you're watching from, and thank you for joining us for another episode of Kidney Hub East Africa. I am half your host, Steve, the Kidney Nurse. Welcome. It's been a minute since we've been on. You know, life is lifing for us. You know, life doesn't stop for us. And sometimes other responsibilities come at play that prevent us from hosting the show. But thank you. As always, I have our brother from Kenya, Moses Kennedy. But let me share what we're about to talk about today. I gotta get my hat straight. This is live, but hey, that's how it is. We're gonna talk about the importance of being a caregiver, especially for someone with ESRD, also known as end-stage renal disease or kidney failure. Now, I talked about that last night on social media, and today we're going to revisit it, but it's going to be focused and emphasized on our brothers and sisters in East Africa that's dealing with this disease. Because as many of you know, if someone gets sick in East Africa, these countries, in some of the places, they look at it as something, you know, wrong, and they don't want to help. So to help unpack that and then talk about the importance of being a caregiver in East Africa is no other than my brother from Kisumu, Kenya, the kidney ambassador, Moses Kennedy. Let's give him the VIP, excuse me, welcome. Brother Moses, welcome and good evening.
Good evening, Brother Steve. How are
How
you
you
doing?
doing?
Yeah, I'm fine.
Yeah, it's been a minute, man. I know last week I believe you was having some issues with your access.
Yeah,
How's
yeah.
everything going?
It has never gotten better, but then still it's a struggle. As you can see, my left arm is swollen compared to this one. You can get to see.
Okay.
Then you can get to see this one.
Yes.
So I was just discharged yesterday, but they did nothing about it because I should be having a referral to Kenyatta National Hospital, where probably I'm going to meet a cardiothoracic surgeon to review on me. Otherwise, we are optimistic, and I'm glad we are back to this show. And I believe it will help somebody somewhere in the dark corners of this continent.
Mhm. Brother
Yeah.
Moses, did they mention to you or have you heard of anything that you may have some venous stenosis?
Yes, I do. Actually, I was diagnosed that sometimes back. They had to do angioplasty, but then now it is. I mean, as always, you know the challenges that face
And they
us.
mention anything about putting a stent in to keep the vein open?
Yes, yes, ballooning. They've mentioned it, and as I've always said and shared, I cannot meet the cost anyway to do it. So it is one day at a time.
Mm.
Yeah,
Okay.
yeah.
Okay.
So
So
from my neck, all the veins are stretched, are strained. Yeah,
mhm, mhm.
yeah.
And see, again, that's why having programs like this is very important because, Brother Moses, I'm sure you're not the only person in East Africa dealing with this problem,
Absolutely
and
true.
not the only person in the world dealing with this problem. In fact, there's many patients that I know that dealing with the same exact problem that you're dealing with here in the United States. And that's why I asked you the questions that I asked, because they display the same symptoms.
Absolutely true.
But Brother Moses, today we have an important topic. Oh, I believe that's important, being a caregiver. Now, not to, you know, share, all your business or anything like that, but when you first got diagnosed, did you have a caregiver or someone that was helping you out on a day-to-day basis dealing with this disease?
Yes. I had my mother besides me helping me navigating those few days from the time I was wheeled into dialysis, then up to the point where I was now stable to be independent, and that is how I grew from being a dependent patient to independent patient. Yeah. So my mother was there to support me. She had to come all the way from the village and come and support me, despite all the challenges we faced together. Yeah.
Wow.
So
Wow.
wherever she is, God bless you so much.
Now, Brother Moses, let's talk about why caregivers matter, especially when it comes to kidney disease, especially in East Africa. Kidney disease, chronic kidney disease, or kidney failure affects physical health, mental well-being, family finances, and daily life. And now, caregivers are often the bridge between person with disease and the health system, helping them access treatment, stick to prescriptions and diets, hopefully recognize complications early, and then keeping up with appointments. In East Africa, you may can speak on this a lot better than I can, but let me set the groundwork. In East Africa, as the literature says, in other low resource settings, caregivers are even more vital because dialysis centers and specialist services are few. Distances and transport costs are barriers. And formal home support services are limited. A knowledgeable, attentive caregiver can prevent complications, reduce emergency admissions, support treatment decisions, and improve quality of life. Let me stop right there. Brother Moses, do you think that's true what they said, what I just read about East Africa and a knowledgeable and attentive caregiver can prevent complications? Do you think that true?
That is very true in that just all those barriers you've outlined are very true in the sense that um, even within the urban centers where we find majority of the units, there are still other challenges warriors are facing, just like access to means of transport. I mean, how you get to those centers from home to dialysis centers. So yes, these barriers really exist, regardless a warrior is, be it within the cities, because even the cities has its share of challenges that sometimes do not exist in the rural areas. And again, rural areas also have other challenges that really affect that. Yeah.
Okay. So, Brother Moses, let me ask you. Wait a minute. All right. Do you believe that caregivers can also reduce stigma and isolation? Many people with kidney disease face misunderstanding or abandonment. A compassionate caregiver helps preserve dignity, nutrition, and social connection. Speak on that.
Absolutely.
And Isaac.
Caregivers basically provides that link. Let me put it this way: caregivers, they represent the patient, maybe to the care team, and even to communities. They are well placed to explain to community, for example, that the condition of this gentleman, the condition of this lady, look, it's this way. So you should not discriminate him based on the other things. He can do this, he can't do this. Reasons being because the condition affects him to do other things. Yes, so a caregiver provides that critical link between the patient and the care team, and then the patient and the community, so that things like stigma is done away with. Things like knowledge gap is done away with. So I agree with you, Brother Steve.
Thank you, Moses. I appreciate you for comment on that. Now, let's talk about what caregivers can do in East Africa. And even if you're a caregiver in the United States, this applies to you as well. Seriously, this applies to you as well. What caregivers can do, practical actions, medical support, and system monitoring. When we talk about system monitoring, I'm sorry, symptom. I stand corrected. I meant symptom, not system. Symptom monitoring. Learn the diagnosis. If you're a caregiver watching this and you're newly been put in that position, or even you're a seasoned caregiver, some of this may also help what we're talking about. Learn the diagnosis, stage, and treatment plan. Keep a written copy or photo of prescriptions, appointment dates, and contact details for the clinic, meaning the dialysis clinic. Help with medication adherence. I talked about that last night. When it came to what you can do to help your loved one. Organize pills, check doses and time, and watch for side effects to report to the clinician. Now, please, if you're watching this, comment in the chat. We're watching and looking out for comments to see if you're a caregiver, if you got any questions, or you have suggestions that been helping you navigate through the caregiver's experience of someone with ESRD or end-stage renal disease. Monitor the vital signs if possible. You can buy a automatic blood pressure cuff for home, a scale, a thermometer, and you pretty much can monitor your vitals at home. Now, in East Africa, for some people, many, that may be a challenge because we're talking about cost. Blood pressure monitor, a thermometer, electronic, maybe a pulse ox to check the oxygen level in your blood, and then a scale, a digital scale, so you can monitor your weight gain. That's not cheap. That's not free. But if you're able to afford that, The caregiver you find out what the dry weight is, base weight, target weight is all interchangeable. You find out what that is. You get yourself a scale. Now you can monitor your loved one's weight to see how much they're actually gaining in real time. You get yourself an automatic blood pressure cuff. Now you can monitor the blood pressure. You got a thermometer. You may say, oh, why do I need a thermometer? Well, if you have a catheter, right? If you got a catheter, you want to make sure you don't have an infection brewing. What if you start feeling some chills and you got a catheter and you don't put two and two together to think that this catheter may have something to do with those chills? And so you got yourself a thermometer and you check your temperature. And if you see you're like 99 or higher, you need to go get checked out. Don't just take Tylenol to reduce the fever. That's just a temporary solution. You got to find out the underlying cause of why that temperature rose. So again, you can learn the diagnosis, the stage and treatment plan, keep a written copy or photo of prescriptions, appointment dates, contact details for the clinic. Also, you can help with medication adherence, organizing the pills, check doses and time, and watch for side effects to report to the clinician. And then last but not least, you can monitor the vital signs, blood pressure, weight, temperature, and keep a simple log. A simple log. Today, or the date, November 2nd, 2025, blood pressure at 8 a.m., 150 over 60, pulse, 80. We weighed 75 kilograms, and temperature was 98.7. And see, you do this each day, then you can get a running log and see how or what your base temperature should be, your base BP, and your weight. It looks more clear written down. And you can see an average or a history of what you've been doing. Also, sudden weight gain, rise in blood pressure, breathlessness or shorter breath, or decreased urine output are important warning signs. No red flags that need urgent care. Brother Moses, anything you want to say what I just mentioned that a caregiver could do, especially in East Africa, to help their loved one navigate through this difficult process?
Yes. I know that there are so many caregivers. There are so many things that caregivers can do, but let me just add on one or two on the list that you've just mentioned. A caregiver must be very alert and attentive, and must also have some interest of, that passion at heart to, to dig deep into what the patient is going through. Basically, as a caregiver, you must really try to understand, although a caregiver cannot really feel the exact thing what a warrior goes through, but at least get to have some idea, internalize, so that you get to have some idea of what a warrior goes through. So basically, in short, one must be of interest to provide that caregiving services, Brother Steve.
Okay, well spoken, well spoken. Thank you, Brother Moses. Now, let's talk about how caregivers can help when it comes to dialysis specific support. And again, anybody, if you're in the US, United Kingdom, East Africa, over in Indonesia or any Asian country, this is generalized information for caregivers. Okay. So let's talk about dialysis specific support that caregivers can do. So when it comes to hemodialysis, what they can do, caregivers can help arrange transport and timely attendance, making sure your loved one get the treatment on time and can get there and stay the whole treatment. Ensure the patient is on time and well fed per clinic advice. Protect the access. AV fistula, meaning don't take any blood pressure or blood draws from that arm. So if you go with your loved one to the doctor's office or anywhere and they go to the hospital, you want to make sure that they're not taking the blood pressure in the arm where the access is. Like Brother Moses, for instance, if he goes to the hospital or ER, he's not going to let them take blood pressure in the left arm. That's the left arm, right?
Mine is on the right, on the left, yes.
Yeah, left arm.
Yes.
And not draw any blood from that access because they're not trained dialysis professionals to do that. But you wouldn't want, even dialysis professionals wouldn't put a blood pressure cuff on his left arm. Also, what you can do as a caregiver, and I talked about this last night as well, with someone that has an access in their arm, you can watch for redness, swelling, pain, or bleeding from the access site. Also, if you're on here and you have peritoneal dialysis, you want to keep that area around the PD catheter clean. Can't make it sterile, but you want to make it clean. Following techniques during the exchanges, check catheter exit site daily for infection. You may want to help them store supplies correctly and ensure regular follow-up. Also, what caregivers can do, keep open communication with dialysis staff about missed sessions, vascular access problems, or infections. Now, I know that sounds like a lot, but just think about people who don't have a caregiver and they got to handle this by themselves. I had people come up to me or on certain social media sites to ask me, How can I help my family member? And what we're talking about today is one of many, many ways that you can help. Brother Moses, any comment on the dialysis specific support that caregivers can do that I just talked about?
Yes, let me just talk about access. Um, you've just mentioned that we should be taking care of our accesses because that seems to be our one of our lifelines after dialysis lines. And then now, um, if you let it spoiled, then I mean, over something you would really want or you are able to avoid and to take precautions, then it will be really bad on you because it will take you backward, owing that it is through that access that on a daily basis you improve your life as you keep on going. And now, you did mention about ensuring that things like blood draws are avoided, and even the calf. Let me add on so that even the calf should not be on that access arm. And then things like we can also, those of us who can, introduce, or we can advocates for majority of patients to embrace maybe something like a tag, because sometimes you are admitted when you are unconscious or not knowing anything that happens, and then all of a sudden these other health providers who has no knowledge on CKD might end up, doing what is not supposed to be done. Brother Steve, I've seen a case where a patient gets pulmonary edema on admission day simply because it is a common practice. Maybe, I don't know, because that one normally happens in Kenya. I'm not sure if that is the standard practice, that once somebody's in, you start giving in water. You start giving in water, drip, even before any kind of treatment. So this particular patient really suffered pulmonary edema even before treatment began. Yeah.
So they added more fluid onto him.
Oh, more fluid, more than unnecessary. So sometimes this, and Brother Steve, this is why this topic, I told you, it is one of the best topics, because if supposingly you had a caregiver who is well conversant that amount of fluids must be regulated and access must not be tampered with, then you are ahead. You are one step ahead of the others. So basically, what if, Brother Steve, we have something like even, let's talk about something like even having a tag, because I've mentioned you can be admitted while unconscious. And then nobody is aware that you are a dialysis patient for that case. And then they only realize when they get to see maybe other signs, maybe from the history if you happen to work with other documentation, which is also necessary on top of that a caregiver must have, Brother Steve. So yes, taking care of that access should come number one. Yeah, that is my take, Brother Steve.
Thank you, Brother Moses. I appreciate that. Thank you. Now, let's look at how caregivers can help from a nutrition and fluid management standpoint. All right. Again, let's look at how caregivers can help their loved one from a nutrition and fluid management standpoint. So, what they can do, Brother Moses, support dietary recommendations from clinicians or dietitians. Now, I know you mentioned in some parts of East Africa, mainly in Kenya, that you have to pay for nutrition services. Is that correct?
Very correct.
Okay.
Yeah.
So, in other places where you're getting this information freely and don't have to pay out of pocket, or wherever you can get credible dietary information, you want to support that which you get from clinicians or reputable sources or dietitians. Generally, this includes controlling salt, okay, controlling your salt intake, managing fluids between treatments, and following protein, potassium, and phosphorus guidance appropriate to the disease stage. Let me repeat that. You want to support dietary recommendations from clinicians, dietitians, or reputable sources. Generally, this is going to include controlling salt intake, managing fluid between treatments, following protein, potassium, and phosphorus guidance appropriate to the disease stage you're at. 1, 2, 3, 4, or 5. Also, use local foods in sensible ways. Reduce added salt. Limit or modify high potassium foods when advised. And prefer fresh, unprocessed foods. If you can, ask a clinician or trained dietitian to tailor guidance to local staples, ugali, mazi, cassava, rice, potatoes, plantains, beans. Does any of that sound familiar to you? I
Yes,
may be
yes.
pronouncing it wrong.
But
Ugali, maize,
correct the pronunciation.
M-A-I-Z-E, maize, cassava, C-A-S-S-A-V-A, cassava,
Mhm. Yes,
rice,
you're correct.
potatoes,
Correct.
plantains, and beans. I guess that's your diet over in Kenya.
Yeah,
And then they say
almost.
track fluid intake and encourage small, frequent meals if appetite is poor. What's your take on what I just read about nutrition and fluid management?
Oh, yes. When it comes to nutrition, sometimes if you don't get reliable sources of information, then it becomes a challenge to, comprehend how the dietary needs can be met. Reason being, uh, most of the information we use maybe are they come from other sources outside the country. So, for example, the food they would mention in that particular geographical region becomes more expensive, especially when you are in this country, because such foods need to be imported. A very good example, in Kenya, we have tropical fruits that are quite common, cheap, and affordable. But then, with CKD, these fruits are loaded with lots of potassium. So we need to check them. However, the rightful food that need to be used comes from those foreign countries. They are imported. A very good example is apple, which is highly advocated for. But then apple, is not grown mainly within East Africa. Most of the apple that comes from South Africa or Egypt, something like Israel or elsewhere. So this is where you need an expert's view, so that you get to modify, like doing things like leaching to cereals or leafy vegetables that are loaded with potassium. So if for sure you only stick on the stipulated one, for example, cabbage, it might you might get bored, because routines, same food, then you continue decreasing in appetite. So yes, there need to be real modification, so that the dietary need becomes something that can be generated from what is already locally sourced. Thank you so much.
Absolutely, brother. Well explained. Well explained. And it's important. I believe for caregivers, if they can, to track fluid intake and encourage small, frequent meals if you don't have an appetite. Okay, and you can get a book from, at least, well, I'm speaking here in the United States. We have these stores called Family Dollar, where you can buy stuff for $1. I don't know if they have dollar stores in Kenya or something similar to that, but you can get a piece of paper or some small notebook and use it as a tracking method to just keep track of your loved ones' fluid intake, weight, vital signs. But again, a lot of people don't think about that. And I know people who implemented that and they've had good, successful outcomes and knew what was going on with their care. So let's move on. Let's talk about something again that's rarely talked about with patients and caregivers: infection prevention, Brother Moses, and hygiene. Infection prevention and hygiene. This can relate to anyone dealing with kidney disease and their caregiver. Excuse me. Sorry about that. Now, what caregivers can do, um, encourage hand washing and clean food, water practices. For PD, if you're on peritoneal, use sterile. Well, we know there's no such thing now as sterile if it comes out the package, but use clean technique during exchanges. For all patients, watch for infections and fever. Be cautious with traditional or herbal remedies, something that I always talk about, especially in East Africa, where I've seen a lot of on one person on the herbal supplement page. I've seen a lot of comments from South Africa looking for a miracle or trying to help, their kidneys function better. People asking for information. But be cautious with traditional or herbal remedies. Discuss with the clinical team before using them. Brother Moses, on the infection prevention and hygiene, what I just talked about, encouraging hand washing and clean food, water practices. And we know that PD is kind of minimum over there. So, but most importantly, when I just mentioned, be cautious with traditional or herbal remedies. Discuss the increase in practices of people who may believe in these type of traditional and herbal remedies to cure their kidney failure. Because you're right there at ground zero. And I think you may have mentioned a while back or when we first met and started doing these shows that when you first got diagnosed, you kind of maybe seeked into that practice. Talk about that for a moment.
All right. Normally, just like anybody who suffers and yearns for quick recovery, and that quick recovery is not forthcoming, and then you get now, you indulge to, alternative kind of treatment, and it's so-called the herbal remedies. And the dangers that really we have with the remedies is that a country like Kenya, it is not properly regulated. That is why you get to find unscrupulous businessmen. Just they want to swindle and suspecting clients their hard-earned money, because the manner in which the vibrant market system that is there makes one believe that this is for sure a miracle cure, a cure that can cure almost everything under the sun and under the sea. And as chronic disease progress, you even become desperate, because you come up with several challenges that always presents every day, and then with the limitation that you might encounter makes you not able to sometimes do the right thing. You want to maybe just try. Sometimes knowingly it might not work, but you just want to try so that you remain on those books that I even tried this so that you are not blamed. Perhaps with your support system that we urged so and so to do this, to take this remedy. The guy refused. So you end up trying all this manner of remedies. And Brother Steve, I'm telling you, for sure, these remedies in current dispensation, it doesn't work completely. Sometimes back, maybe 4 generations back, I guess it will work because the art was passed from one generation to the other. But then now with the convention medicine that we embrace today has made it the other one a subordinate. So the one that the real Africans used to work with properly. So what we are left with basically conmen. Conmen, wherever you go, and even those who pose to be the men of the collar, they even lie to people on pulpits that this is a remedy that heals. So it is quite unfortunate, Brother Steve, that this is happening.
Yeah, that's very sad. Swindling people out of hard-earned money that they don't have to be given to something that's not going to, make a difference. Let's move on to how caregivers can offer emotional, social, and practical support. Now, it's advised that they offer regular emotional support, listen, and help the person keep social ties and meaningful activities. Help with logistics, arranging travel, collecting prescriptions, and communicating with family and employers, managing finances where necessary. And then advocate for the patient with healthcare workers, insurers, or aid organizations. Now, Brother Moses, you being in Kenya, is it what I just read? Is any of this practical in Kenya when it comes to caregivers, like where you go to treatment or the treatment centers you've been to, and you saw a family member with the patients maybe sitting in the lobby or at an event, and I said to them, if I was there and I said, no, this is how you can help. Emotional, social, and practical support. You can offer regular emotional support. You can listen, and then you can help the person keep social ties and meaningful activities. Also, you can help with logistics, arranging travel, collecting prescriptions, communicating with family and employers, managing finances where necessary. Also, advocate for the patient with healthcare workers, insurers, or aid organization. Now, to be honest, for the average Kenyan where you're at, or the average East African dealing with kidney disease, and they have a caregiver, what I just read, is that practical for the average caregiver of someone with kidney disease in Kenya or East Africa can continue to offer regular emotional support, listen, and help to keep social ties and meaningful activities. Is that really practical, in your
Not
opinion?
practical, not practical. But then there is that a small fraction of caregivers. Perhaps if you have a supportive spouse, or some say like others have supportive um, maybe friends, very supportive. And then we have this category, maybe siblings, right? However, if the knowledge gap is wide uh, amongst patient, then I guess it is even more wide to to caregivers. So yes, it might not be practical in the sense that there is lack of information. People still doesn't have an idea of the effect of CKD. And majority fail to understand that the effect of CKD are long term. You just don't support somebody, say 1 month or 2 months, then you disappear. So it is not practical because of that knowledge gap, Brother Steve.
Okay, got you, Brother Moses. Also, with arranging travel, collecting prescriptions, um, communicating with family and employers, managing finances. For the average person dealing with that, I mean, do you have many patients on dialysis that work also? I know you mentioned that you had trouble finding work and dealing with your schedule.
Yes, you need to get one that really accommodate your schedule, because it is you to comply with that particular unit, so that you don't miss any session in between for any other reason. Yes, you have to get somewhere that you can be included in that decision making and session scheduling.
So let me ask you this. The last one, it says advocate for the patient with healthcare workers, insurers, or aid organizations. Now, you know all too well about all three. What could a caregiver do to advocate for the person with to help caregiver? Well, we know they can go and speak in their behalf, but when it comes to insurers or aid organizations, how can advocating to them benefit the patients when with insurers you going to get is maybe one? Is it more than one insurer? National Health. What is it? Isn't that the NIH? Or
It changed. We have today, it's called Social Health Authority. It is
okay.
called SHA. Yeah, from NHF. Now we have SHA. Mm-hmm.
And so, is there anything caregivers can do to advocate for the patient with SHA? I mean, it's
Not
not going
really.
to increase finances or anything like that, right?
There is no package that the government provides through its insurance, social health authority. There is no any other arrangement that the government have, including the free, the primary healthcare that is that is well articulated, that includes education and awareness, the government is not clear about it and has no package for it. So it is upon individual caregiver to seek for knowledge and to impact as much as she or he can.
I understand. Now let's talk about something that you've been involved in Kenya, advocacy and community participation. But it says that caregivers can help in navigation, advocacy, and community resources. Now, a lot of times, even though we can look up the information that says that, but when we actually put it in practical use, a lot of times these resources are not available. But it says identify local resources, public hospitals, NGO programs, patient support groups, faith-based organizations, microfinance schemes, national kidney societies, and international organizations, IG, International Society of Nephrology, that may offer education, financial help, or referrals. And then it says help apply for social support or charitable funding and keep records of costs and bills. Promote prevention and early detection among at-risk family members. Screen for hypertension and diabetes in relatives. I mean, I'm sure all that costs to get screened, but when it comes to these NGO programs, patient support groups, faith-based organization, microfinance schemes, have any of these actually helped you or anybody you know financially to help alleviate some of the cost of treatment, or if you needed to get additional work done, like with your arm? Have any of those organizations come to your aid to help you defray that cost?
No, Brother Steve, let me tell you one thing. Most of the things that even we have in Constitution that are in black and white are well articulated. They are never practical. For example, there is no NGO that supports warriors anywhere in Kenya. In fact, there are places that they do not even have a facility far 300 and above kilometers apart. There are counties that are really starved. So getting financial support is just, you can't imagine that. Away from maybe what the government provides during transplant, which is always almost a quarter of the total amount that is needed. So yes, there are no NGOs that gives financial support for any activity that pertains CKD. As we speak, there are other things in health sector. Let me just mention for clarity, malaria, HIV, and treatment, those one does exist. But for CKD, except for the hospitals that are just doing medical camp to link the society and their hospital, which is sometimes also shoddy because you are told, for example, that we shall have free clinic camp, that we are going to, you will know
Uh-oh. Look like we may have lost Brother Moses to the internet, to the internet demons. Hopefully we'll get him back. He froze up. Again, we often have issues coming out of Kenya when it comes to internet connections. So I hope to get Brother Moses back. We must continue with the program. Now, when it comes to end of life and palliative care for caregivers, like over in East Africa or anywhere, when dialysis is not available, appropriate palliative care can relieve symptoms and improve comfort. Caregivers can coordinate symptom control, psychosocial support, and advance care discussions according to the patient's value. Now, let's talk about caregiver self-care. Because you're doing all this for your loved one, you also got to have self-care for yourself. And let's look at how that looks like. Caregiving can be physically and emotionally draining. Seek peer support, respite help, and practical support from other family members or community volunteers. Look like we may have got Brother Moses back. Brother Moses.
Yes, sorry for that interruption.
Yeah, we lost you there for a minute, but I have moved on to talk about end of life and palliative care and what caregivers can do. And what I mentioned, when dialysis is not available, appropriate palliative care can relieve symptoms and improve comfort. Caregivers can coordinate symptom control, psychosocial support, and advance care discussions according to the patient's value. And then I was just on caregiver self-care, because caregivers need self-care. And I mentioned caregiving can be physically and emotionally draining. Seek peer support, respite help, and practical support from family members or community volunteers. Now, this is very important, what I'm about to say. Watch for caregiver burnout. And how does that look like? Persistent exhaustion, irritability, neglecting your own health, Ask for help. Okay? Don't be too proud. Ask for help. Accept it, because being well yourself, makes you more effective in helping your loved one. Brother Moses, anything you want to mention about end of life palliative care or
Oh yes.
caregiver
Oh yes.
self-care?
Oh yes. It must be one must understand that there are situations where even the patient himself cannot accommodate the replacement therapy dialysis. So if one decides not to, for any other reason, be it personal or something to do with faith, or or individual's determination to survive, then it must not be confused with suicide. You tell somebody, because before you've told people that this is my lifeline and I have to be on on this machine twice a week or thrice a week, and then all of a sudden that is what sustains you. Then you say, oh my, uh, I want to have I just want to rest and have my just symptoms maintained and checked on. But then now, it will be again misunderstood that this particular patient is trying to commit suicide. So these are very critical decisions sometimes when we patient we have to make, because it can really signal something that you never intended to. So we must be very cautious, Brother Steve,
Thank you for
when
that.
it comes to palliative decision making.
Absolutely, absolutely. Um, so let's move on. We're at over 14 minutes. This is going to be a two-part show. Next week, we're going to talk about caregiver one-page checklist that you can use to help facilitate this journey in being a caregiver to your loved one. So that's next week, checklist. So as we move on, we're going to, right now, we're going to talk about simple tools and habits that you can start today. That you can start right now once this program ends as a caregiver. Simple tools and habits that you can start today. Not wait till next week. Start today. 1, keep a single notebook or a phone folder for medications, appointment dates, blood pressure, weight log, emergency contacts, and healthcare papers. 2, make a weekly pill organizer or chart. 3, prepare a transport plan for dialysis days, backup contact, money, or community transport. So if you're in Kenya and your normal ride don't come, Maybe you got a friend that got a scooter, because I know over in Kenya they ride mopeds or the motorbikes, weave in and out of traffic. But wherever you're at, United States, East Africa, and I know it over in East Africa, it may be hard to have a backup plan to get the treatment. But whatever you can do to have a backup plan in case your original transportation, something happens with that, then you got somebody that you can rely on or call to take you to treatment. Learn 3 urgent signs that require immediate medical attention. Learn 3 urgent signs. These for caregivers. Learn 3 urgent signs that require immediate medical attention. Now, let me give you the red flags. Seek urgent care if you notice severe breathlessness or shortness of breath or sudden shortness of breath, chest pain, fainting, or severe dizziness, sudden confusion, seizures, or collapse, sudden decrease or stop in urine output if previously producing urine, very high fever or signs of access catheter infection, redness, pus, severe pain, sudden large weight gain in a short period of time, fluid overload. Brother Moses, anything you want to add into what I just talked about the simple tools that people can start to use today, like keeping a single notebook and folder for the medications and dates and blood pressures and a log, making a weekly organizer, pill organizer chart, or having a backup plan for transport, or learning urgent signs that require immediate care. Anything you want to say about that?
Oh yes, let me just echo something you mentioned. Just like having a folder, the soft copy, you must also have some folder, something like a bag that you can populate your drugs and everything in hard copy, including latest investigation lab works in a particular bag. That each time you visit, you go visit not only to see a doctor, but for your sessions, you should always carry along. I've always practiced that, and it does pretty well. I guess it can help others in that way. Yeah, back to you, Brother Steve.
Thank you, Brother Moses. I appreciate that. Now let's look at context-specific advice for East Africa. Context-specific advice for East Africa. And Brother Moses, you tell me if any of this is relatable to you. 1, expect long travel times, limited dialysis slots, and variable supplies, plan appointments, stock checks, and transport in advance. Use community health workers and local clinics for screening and routine monitoring when nephrology services are far away. Educate family and community to reduce stigma and encourage earlier presentation for care. Work with patient groups and NGOs. I know you said there's none over there that may provide financial or logistic support. Local kidney foundations sometimes help with transplant referrals or dialysis subsidies. Be aware of infectious disease risk, waterborne illness, malaria, hepatitis B and C. Ensure vaccinations and infection prevention are addressed with clinicians. You want to speak on any of that? The context-specific advice for East Africa? Like expect long travel time, limited dialysis slots, and variable supplies, plan appointments.
Yes.
Is that all
No,
true?
very true. Number one, even the established dialysis units that are there are faced with quite several challenges, including even scheduling warriors, because today you go to this particular unit, the package is served in a different manner. You go to unit B, what you missed in unit A is served in B, so and vice versa. It is never easy sometimes to predict because each unit tries to accommodate her own interests so that to get to win patient. Remember, Brother Steve, most units that are the government of Kenya lacks that capacity to, to provide the necessary units that is enough to. So there is a gap that the private sector is filling. That is, it is also crucial. So amidst all those challenges, still. Others stand out, like maybe scheduling, proper procurement, those logistics still becomes a challenge, Brother Steve. And then
Sure.
even the ones that we have are huddled. Patients are crowded in that one particular thing, and they end up not providing standard services. But initially, all of them begins with a very clear vision, and even the service provider over there is always so nice from the beginning. But now, once they establish their clientele base, it becomes something else that you will never imagine, Brother Steve. So that is the main challenge also that happens on the ground. Yes.
So caregivers should be aware of that.
Absolutely. Because that is why I even said before that a caregiver must really have interest knowing how these things operate, the different types of machine, who is the most sought nephrologist in town and so forth. Yeah, without interest, you will always, a caregiver will always remain as a passenger and will only exist by rumors, based on rumors, will guided by rumors, Brother Steve.
Wow. Wow. Okay, that's why we had these shows to dispel rumors and give evidence-based information. So, last but not least, for caregivers in East Africa or beyond, when to get professional help. So, for medication changes, dialysis problems, nutritional planning, vascular access issues, or complex symptom control, consult the treating nephrologist, clinic nurse, or a trained clinician. If they are not available locally, reach out to regional centers, mobile clinics, or telemedicine options if available. Now, this is for specifically our brothers and sisters in East Africa, but if you're here in the United States, if you're having any of those symptoms, you can just go to the emergency room. For some people over in East Africa, they may be in a remote village or remote place where the travel time could be hours before they get to a treating hospital or clinic. So they may have like a local clinic that may not be able to accommodate or handle the complex problems that people who deal with kidney failure may experience. Brother Moses, you want to comment on that right quick before we get ready to close the show?
Oh yes. Let me encourage our caregivers to also seek knowledge, so that knowledge builds that interest that enables proper caregiving, and then admit where you are faced with challenges, and above all, a caregiver must be ready to communicate whatever the circumstances. Back to you, Brother Steve.
Thank you, Moses. I appreciate that. So, as we close the show, we hope whoever's watching, wherever you're watching from, that you're able to apply any of the suggestions that we talked about into your life to help your loved one who may be dealing with ESRD. Brother Moses, do you have any last words for people in East Africa that may be dealing with kidney disease and they have a caregiver of a newly diagnosed patient or a seasoned patient or a seasoned caregiver? Do you have any important words that you would like to say pertaining to today's show?
Yes. To those who are newly diagnosed with CKD, always make an effort to have your caregiver just from the word go, so that he gets involved and get to know the progression of disease and treatment, so that each step everyone is incorporated each step as it goes by, because now once kidney disease gets into CKD, then there ought to be a long-term plan. So yes, I want to encourage those who are newly diagnosed to encourage having their caregivers just from the day one get involved. Thank you.
Thank you, Brother Moses. And I would like to thank everyone, or we would like to thank everyone who watched the show today, and ask you to continue to watch the show and your support, because shows like this you rarely see, where you have professional, as well as an advocate and a person dealing with the disease itself firsthand, giving out information, trying to help the population, especially in East Africa and beyond, that's dealing with this. And again, today's show, the importance of being a caregiver is truly important, especially if you have a family member that's just been diagnosed. So if you have any, if you're in East Africa and you got any questions, if you're on Facebook, please reach out to Brother Moses Kennedy, the Kidney Ambassador, at the FIGO Initiative Facebook page. He's more than welcome to answer any of your questions, comments, or concerns when it comes to CKD in East Africa. And you can reach out to me, Steve the Kidney Nurse, Facebook page, TikTok, IG, or my website, stevethekidneynurse.com, and hit contact us. But we greatly appreciate you tuning in for today's show, and we wish everyone a great week. Brother Moses, any last word before we get out of here?
To all viewers who are watching, we are so grateful for supporting this program. We encourage you to stay tuned, same hour, same time, every Sunday. Best wishes to all.
That's right. And remember, now, because the day, well, here in the United States, at 2 in the morning, it's the end of daylight savings time. So we pushed the clock back, I believe, 1 hour. So now, instead of the show 1 p.m. Eastern Standard Time, USA, and 8 p.m. East Africa time, it's still going to remain 8 p.m. East African time, but now it's going to be 12 p.m. Eastern Standard Time, USA. Starting next Sunday, the show will start at 12 p.m. in the United States, and will continue to be 8 p.m. East African time. With that being said, thank you, everyone. Brother Moses, have a great week. Best of wishes to you in treatment on Tuesday. Again, thank you
so much.
Yeah, thank you for taking the time out and co-hosting like always, and may peace be with you. Everyone else, have a great week. God bless, and we'll see you soon. Peace.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.